And talking about health, former Health Minister Dr. Richard Anane has cautioned against politicization in managing the National Health Insurance Scheme. In an exclusive interview with TV3, Dr. Anane said the NHIS can only be effective if the right measures are incorporated.
Piloting might have contributed to the problems or the challenges.
You know, you talk about pilots. A pilot is a test to see whether something can work. So if you are going to do that, you don't use the large population. You don't use the large population. You should use the small population to test, to see, and then to find out whether there are any shortcomings so that you correct them before you apply them to the larger population. But in this case, the large population was used. And a very short period of time was used in educating the people. So definitely you have to get the people to resist. What is this? Why is it that we are the ones that you are using on? Why not other areas?
So as a technical man,
I am not a technical man. I am a member of parliament.
But you and it was under your administration, when the whole thing was initiated. What advice will you give? The way forward.
The way forward to me is that health insurance has come to stay. We should do everything collectively from both political sides to make it survive. The people under whom health insurance is being managed today must listen to the other side when they talk. Because when anybody gets sick or when sickness is moving in the community, it does not determine that it's going to hit Party A or Party B individual. It goes to hit everybody. Assuming there was an epidemic, it hits everybody. So if we have a scheme that is coming to solve some of our problems, and then we are facing challenges, we must together see and find ways and means of resolving it. We must not look at it from coloration, party color and other things. I think the better for us, the better maybe strategy for us is to look at it from a non-partisan standpoint and to see how we move forward. You see, when President Obama wanted to fiddle with, to, so to speak, bring some changes into the health insurance scheme in the U.S., you see the kind of problem that he was confronted with. That's Obamacare. And it's still not studied. It tells you how sometimes even emotive health financing can become if you do not get all sides of the political divide. So we must do everything to make sure that once it is being started, and once the people of Ghana have found that it is good, if there are any measures or any steps that we want to take within it, which do not seem to be understood by all, we must come to terms, we must meet all our stakeholders, come to explain them so that when they all understand, they also become evangelists to explain to other people for this to be accepted by all, for the insurance scheme to go on, and for Ghana to be the winner.
All right. Now, the government has also proposed for a one-time premium. What's your take on that?
I do not think government did say something on the platform some time back, but I don't think they can stand by it. In December last year, we went for a stakeholders conference. Another stakeholders conference, we advised government that one-time premium was not going to help. And so, by the communique, which was issued after that December 2012 stakeholders conference, government has done away with the idea of one time.
And talking about 10 years after National Health Insurance Scheme operations, do you feel discriminated against for carrying an NHIS card? Or better, have you been to the hospital and expected to have simple services such as blood transfusion for your wife and be told it's not included on the NHIS list? Well, we leave these questions to you to answer. But 10 years on after the establishment of the National Health Insurance, today we critique the program and the possible improvements.
Established September 5, 2003, the National Health Insurance Scheme was to abolish the cash and carry system in the country's healthcare delivery. This is expected to provide financial risk protection against cost, quality basic health care. 10 years after being hooked onto the National Health Insurance Scheme, some patients at the Kanishi Polyclinic still maintained they are dissatisfied with the services delivered.
So we are in no be between Mujamona and cover no enye. Minimum senka health insurance there. A be cover bibia, but when it cover bibisa.
It is terrible. The NHIS does not cover blood transfusion. I thought the insurance would cover all medical bills, but it does not.
Penny ediba mami wo I know the ediba mami no enye, but say ye trauma me no ye tro de ne boarding am koto no abonten. Me nso sua ne na nka me pese nke duro bia on ba tro bia nko mo fa maye wo ba ntimi nkova nyina.
Planning de ebi wo wa akoba ebi wo wa nkoba. Ebo ne ya ne boy de na nkoba no.
It does not cover all the drugs, especially the expensive ones.
Till date, the actual proportion of the population with active cards stands at 35%. These have raised questions over the low membership.
Even when you are using some of the medications, they don't give you the right one. They give you something that it doesn't really, it's not effective. You know, that is why some people are saying, so it put me off. And I met a doctor who also gives money to patients to go to drugstores to go and buy the correct medicine. So it put me off entirely.
Physician's assistant Joyce Abrokwa is worried hospitals get payments of drugs and services too late, making it difficult to sustain the program.
The amount to be given to the hospital for the purchase of drugs, they don't come on time. I think that we haven't come very far, although it's 10 years now.